This week we go with the corporate support group to a field trip in South Sudan to show them what the ICRC is all about in the field, to make them live through the experience of being a delegate and to see the reality of such a big operation the ICRC is leading here in South Sudan.
When we flew over the region, one could think that there is nothing at all, and then suddenly there are hundreds, thousands of people coming out of the bush, waiting for their food, waiting for help of ICRC. So that's really very emotional to see that. We saw as well how the people that have been identified by the ICRC collected it, piled it up. The ICRC is able to help people in locations where no other organization can.
We are at the UN Civilian Protection Camp. The ICRC and the Sudan Red Cross is really helping the people to get contact with their families and reconstruct their families.
We are here in the ICRC water treatment. The aim of this station to stop the cholera at the high season of it. We find a good location and a good site equipped with 2 pumps taking of the water from the River Nile and then making the treatment and then distributed it to 9 locations. They didn't have any source of water. It's good, but it's working for the emergency cases. For the long term, we need to develop it more. We have corporate with the ICRC and different locations, last one in Syria and in Baghdad. And we come today to visit this site, to looking in the future how we can support them in this location and what we can do.
So we are just watching a match, a basketball match with people who are doing this match in a wheelchair. So it's very amazing. We gain information by going on the field. We see what are the real needs, because when we do it in a theoretical way, we do not see what are the kind of things the people need. I think it's very important also you be aware of the kind of things we are developing, because we are not always sure that the kind of things we are doing are useful. And we are not sure that you on your side are always aware of the kind of things we can do for you. We have, for instance, developed X-ray apparatus for the countries, for the developing countries, for helping people just to get an X-ray radiography of their breast or their lungs. It's very important also to participate to this kind of journey because we see the real things.
This visit for me was very enriching, very interesting, and it is eye-opening. ICRC teams, they live in very tough conditions, sometimes in places where you have barely water. You sleep almost outside and you stay for 2 weeks or even sometimes months in very exposed places, very often as in this northern part of South Sudan, where you also have war risks and shooting.
It is extremely important to show to our corporate donors such a comprehensive operation as South Sudan is. And of course it is important in our times to work also with the private sector, because it is possible to mutually learn from each other. We learn from them their new technologies. For instance, we work together with ABB on new smart grids. We work together with Philips on new medical technologies. And they, from the other side also, they want to be socially responsible. And that's what they are seeking in the collaboration with the ICRC.
We are in Kodok, at the hospital run by the ICRC. Communities such as the one in which we are subject to a double disease of burden. not only on the communicable diseases such as malaria and polio and tuberculosis, but the burden of disease of the non-communicable diseases is increasing also extremely fast, which means that the need in order to solve the problem is even heightened. We have more than 700 million treatments of malaria dispensed to patients in need since this program started in the last 8 to 10 years. Having said that, it's important to realize that the magnitude of the problem is of such vast dimensions that it's completely impossible for any single actor to be able to solve any world problem associated with health. The cooperation and collaboration with multiple actors that have a stake on the ground and have a particular area of expertise is fundamental.